It's been nearly a year since a Boston pediatrician stepped down as editor-in-chief of the Journal of the American Medical Association, the result of another editor questioning whether racism even existed in medicine on a JAMA-affiliated podcast, a question JAMA later promoted on Twitter. This week, the Journal announced his successor, the first person of color and only second woman ever to serve in the job, Dr. Kirsten Bibbins-Domingo, who joins me now. She's a longtime health equity researcher and advocate, an internist, cardiovascular disease epidemiologist, and a professor at UC San Francisco. Doctor, good to meet you.
Nice to meet you.
Congratulations, I guess, but you said it's your dream job. A dream job walking into an editorship of a publication that's been mired in quite a bit of controversy.
Well, there's no question that JAMA and the JAMA network of journals are a really extraordinary platform that is publishing high quality science across the broad array of medicine. And that's what makes this job a dream job, having the chance to shape the type of communication, the type of science that's published to the broad audience that JAMA and the JAMA network of journals reach. And that's what I was excited about. I think it's never been more important to have a journal and a network that is transmitting high quality science, talking about the issues of the day that shape science and medicine, and doing so with a trusted voice and a broad reach.
You know, you said at the time of your selection, this is an extraordinary time, as you just said, for science, medicine, and public health. I would agree, but maybe not in the exact same way. I want to put up a couple of polls from January of this year. I'm sure they won't surprise you. From the Nork Center for Public Affairs. Would you say you have a great deal of confidence in the scientific community? 64% yes Democrats, only 34 Republicans. Would you say you have a great deal of confidence in medicine? Both underwater, 45% Democrats, 34% Republicans. How do you break through that level of cynicism and polarization?
Yeah, I think what makes this a really interesting time is that we are at really a pinnacle of modern science and medicine, the ability during this pandemic to translate so quickly into highly effective vaccines, highly effective treatments. And yet within the same pandemic, we have divisions across, here you've highlighted political lines, we have divisions across many lines in the way in which that same science is viewed by different audiences. And I think that is, it is an interesting time. We see this actually across a number of sectors. I think, as many people point out, when people lose faith in an institution, it's also incumbent upon that institution to help restore faith. Some of that is about understanding what it is that we're publishing, and some of it is about thinking about the many ways in which we communicate to a diverse audience, diverse across multiple dimensions, including political, as you suggest.
I want to talk about restoring faith, to use your expression, following these instances, and they're not isolated, of racism. That podcast I mentioned the tweet now deleted by JAMA. No physician is racist, so how can there be structural racism in healthcare? An explanation of the idea by doctors for doctors in this user-friendly podcast. Speechless. And obviously it's not just in the publication. I remember, I'm sure you do better than I, a few years ago, I think it was 220 white residents were surveyed. More than half of them thought their black patients had thicker skin, had higher resistance to pain. And it's almost like a science fiction movie. How do you fix what is clearly broken?
Right. The first thing is for us to be able to talk about it, name it, and be truthful about what it is. That medicine and science don't exist apart from the larger conversations, the larger structural biases, racism, and inequities that exist within society. And in fact, in many ways, racism in medicine contributes to the larger issues of structural inequities that we see. if we as a larger society, and then in particular in our profession in science and medicine, want to address these issues, we cannot be slow to name them. We cannot be slow to acknowledge both the history as well as its influence on our current contemporary practice. Doing so is the important first step in righting this wrong. I think the podcast and the tweet and the types of self-reflection that JAMA and the JAMA network have gone through over this last year are emblematic, actually, of the entire situation that medicine and science have to go through. And I think that's the important thing to remember. None of us is immune. This is not a single person's issue. But if JAMA wants to be a trusted voice for science and medicine, we have to be the first to acknowledge very clear things that are shaping medicine.
As I mentioned when I introduced you, Doctor, health equity has been at the center of your career. Are you of the opinion that the spotlight that has been put on health inequity during COVID provides fertile ground for work like yours? Or is this like a passing thing? We care about it deeply and then we just move on.
Yeah, it's complex, as you just said. It's complex because in a good way, it has the pandemic has shown a light, as many have said, on the deep inequities that existed well before the pandemic, and the pandemic made worse. There's also very interesting science out there right now that is suggesting that as people talk about the pandemic and the inequities in the pandemic, it leads others to think that the pandemic is about those people, experiences of other people. And it actually, sometimes we have to be cognizant of it because of the way it is heard by others. And so that's the challenge, I think, of a great journal, is to continue to communicate the science, to continue to be clear on the issues that are faced by multiple communities across the US and globally in the types of diseases that we are covering, but also to do that in a way that continues to engage in a truthful way at the forefront so that we can help to move science and medicine along.
Can we focus on one health equity issue for a second? I'm sure you saw the op-ed in Elle magazine that Serena Williams wrote after giving birth. I'll read just the part. In the U.S., black women are nearly 3 times more likely to die during or after childbirth than their white counterparts. Being heard and appropriately treated was the difference between life and death for me. I know those statistics would be different if the medical establishment listened to every black woman's experience. As you know, it's Black Maternal Health Week. The Boston Globe, in a piece this afternoon, said giving birth while black should not be a death sentence. But it's clear to me as a non-medical professional, it's not just about better health care and better listening. It's addressing all the social determinants, from can you get to the doctor with affordable transportation? Do you have decent nutrition, good schools, safe neighborhoods? That's a big nut to crack. Is this society ready to address health equity in that kind of fashion?
Yeah, it's a big nut to crack. But what I love about Serena Williams using her voice in this way is that it highlights a really important health issue right now, the fact that our maternal mortality rates are on par with countries we don't usually show up on the same list on. And that is something that we should all feel shame in and work actively to try to reverse. But the issues that you're talking about, the issues of access and socioeconomic status and where you're going to receive care, which affect so many in the US and absolutely contribute to maternal mortality, are not the issues that contributed to Serena's case. And it does highlight that we have to talk about all of these issues together, including the types of issues of bias and racism that clearly lead certain people to have different encounters in clinical settings than other people. And we have to be willing to talk on these issues and understand the complexities. All of these issues are important. And the fact that they're contributing to these shockingly high rates of maternal mortality are ones that we need to be talk about and see interventions that are reversing them.
Doctor, once again, congratulations. I wish you a lot of luck. Hope to talk to you again soon.
Thank you.